Thing in progress.
Thought I might get these sorted out. Well, good morning, everyone. Happy Wednesday. This week, I thought I said it was a long week on Monday, and now it's Wednesday, so glad we're here. I'm Angel Metro with Health Vision, the Fort Wayne director, and we are blessed to have Sharon, who has not been in the office lately and has not been at one of our meetings in a while, so you all can touch base with her. But I would like to open this meeting up with just a brief meditation, kind of bring us all to our place where we are now, to a calm place, and get grounded and set our intentions for the day. And I'll just get comfy in your seat, close your eyes. Take a deep breath in through your nose, and then blow it out slowly through your mouth. And I want you to start with your head and just start to feel the flow of your emotions, just the energy in the room. Think about any stress or anxiety or anything that you have going on, and just imagine it drifting out of your body with every breath that you blow out, blow all of that out. And then flow down into your shoulders. A little shoulder shrug and let all that stress go. That's where I carry my stress. Shake it loose. And flow down into your abdomen. Let anything you're holding there flow out. And let it flow down to your legs. Down to your feet. Let go of anything that's holding you back, anything that's been a blockage for you. Let that flow right out. I would also like to take a moment to just say a prayer over all of the children and families that were affected over this weekend by the shooting. And those of you that have not heard, there was a shooting at a local party for teenagers just having a regular Halloween party, and one individual was lost and 10 individuals were injured. We can just take a moment to send our positive thoughts, healing energy, and prayers to the families that are dealing with that, and the students and the individuals affected by that. When you're ready, let one more nice breath in and out, and then we'll come back from there. Thank you, everyone. I would like to start with introductions. So I introduced myself. We have a couple new faces in the room today. We have some of our team members from our Hammond office here today. So today's kind of a special meeting. Andy, would you like to start with introductions?
Hi, everybody. My name is Amani Family. I am the Health Vision Director in our Hammond Lake County location. And I'm just really happy to be here. We in Lake County, we started our own health equity coalition just this year. And so it's really an awesome time for us to come and see what Portland has been doing now for quite some time, how we can maybe collaborate and see how we can all work together.
Morning, everyone. I am Deja Bailey. I'm the outreach coordinator at the Hammond Health Visions branch. I oversee the coalition in our county, so I'm really just happy to be here for some new things. Thank you.
Hello, I'm Natalie Alvarez. I'm the program manager in Hammond, and I oversee the health program for we have with
I'm Winnie, and I am a bilingual community health worker, so I teach the classes for some of the programs that we have in Hammond.
I am Lauren Dwyer from Catholic Charities Fort Wayne. I'm here to, since he's speaking.
I'm Althea Show. I'm also in Catholic Charities. I'm our operations and training specialist.
I'm Janet Mayer with Further Extension with the program, the nutrition.
Kiana Cox, I'm here, this is my business is Key Ingredients and Rhombus Incorporated, and also on behalf of the board member for Oxford Community.
I'm Danielle Burge, I'm the education and outreach manager at Super Shop.
I'm Carla Kilgore. I'm the Director of Mission Advancement at YWCA Northeast Indiana.
Oh, I'm Stacy Merrick. I am the clinical manager.
Good morning, everyone. I am Mia Hinton, Healthy Child Advocate and Outreach Coordinator here at the Business at West Fort Wayne.
Good morning, I'm Jennifer Robbins. I am the quality leader for IU Health.
Hi, I'm Julie Nace. I am with Associated Churches, the Journey Beside Mothers program. And I am the Journey Beside Mothers director and wellness nurse. Think good today.
I'm Kyle Lumford. I'm the Director of Homeownership and Community Development at Rock Mortgage. And I'm just happy to be in a room with all you beautiful, wonderful people. Good morning, everybody.
Good morning.
Cassius Stallings with Health Visions in West of Fort Wayne. I serve as the Wellness Coordinator. Also happy to see you all.
I'm Lupita. I'm the Latino community people worker. And thank you for everybody being here.
I'm Ben Hayes. I am the community health worker trainer, and hi, everybody.
I love it. Okay, on Zoom land, let's just start with Colleen, and I'll let you guys each pick who you want to go next, and we'll pop through.
Hey everybody, I'm Colleen Carpenter with Stop Suicide Northeast Indiana. I'm having a little trouble hearing, but I think you told me to pass the baton to someone else. So I'm gonna pick on Dr. Diana Jackson.
Okay, sorry, we're also having trouble hearing. Give us 1 second.
Good morning, everyone. My name is Diana Jackson Davis, and I'm the Director of Language Access and Cultural Services for Parkview Health. And just really happy to be here. Good seeing everyone.
Good morning.
Good morning.
Good morning, everyone. My name is Sandra Thomas. I'm one of the client advocates at Cancer Services, and I am happy to be among all of you professionals.
Thank you, Sandra.
I'll go next. My name is Jill Shimon. I'm with the state of Indiana with Indiana 211. I'm a community engagement coordinator.
Good morning.
Hi, I'm Denise Knivler. I'm the assistant dean at IU School of Nursing.
Good morning. Thank you.
I'm Jamira Fields. I work for Bright Point as an outreach coordinator for covering kids and families.
Good morning, everyone. This is Celia Reyes. I'm the community engagement specialist for MDY's Medicaid. Nice to see everyone.
Hi, good morning. This is Esther. I'm sorry, I'm driving to an event, so I cannot show you guys my face. I'm with United Healthcare Medicaid. Glad to be here today. Thank you.
Good morning. Welcome.
Good morning. I'm Felicia Say. I'm with Aging and Home Services as their nutrition supervisor.
Good morning, Felicia.
Hi, I'm Kelly. I'm Kelly Bauman. I'm with Associated Churches.
Good morning, Kelly.
This is Sheila. Sheila Curry Campbell. I'm with Pilgrim Progress Community Development Corp. Also serve as a board member. Thank you.
Morning, Sheila.
Melissa Martinez, Allen County Public Library.
Good morning, Melissa. Good morning, Laurie Weinzaffel from United Healthcare. Good morning, Lori.
Good morning. My name is Audrey Dominguez. I'm the clinical coordinator and immunization supervisor at the Allen County Department of Health.
Good morning, welcome.
And good morning. I'm Kathy Thornton with the Allen County Health Department, Director HIV STD Prevention.
Good morning.
Good morning. I'm Shelby Vanderber. I'm the Director of Counseling and Care Coordination at Great Heights ABA.
Good morning, welcome. Okay, I think we made it through everyone. So with that, I will move on to all of our presenters today, let them introduce themselves, and we will begin the presentation.
Good morning, everyone. I didn't know that the whole community, in the television, and the whole room, I didn't know that. I just expected a few people to speak today. Everyone, my name is Yen Chen. I'm working with Refugee Service for the Diocese of Fort Worth South Bend. I've been with the program for 24 years.
I'm supposed to go next.
Yes, go ahead, please.
Okay. Hi, everyone. I'm Jackie Martinez, and I just started with the St. Joe Community Health Foundation 3 months ago. But before that, you guys probably know me from Healthier Moms and Babies. I was there for 9 years, and before that, Victim Assistance for 10. So 20 years, so almost. And so happy to be here. Thank you so much.
Thank you guys for coming.
So we are going to tell you a little bit about the Fort Wayne Refugee Health Collaborative. This collaborative is an initiative of the St. Joe Community Health Foundation, supported by the IU Health Foundation, to really be meant to be intentional in serving our Burmese community. It is a collaborative and it's an initiative to be meant to offer rounded services for Burmese refugees. So when you think about eligibility, well, I should say Burmese nationals, because they don't have to be refugee status. So the extent of what we are trying to accomplish is providing case management services in physical health, emotional, mental health, and accompaniment and supportment as our Burmese neighbors are here having to learn a new culture, many of them having to be away from their families. And how can we really wrap our arms around them to welcome them and include them in our community as they are now, as they are here with us, eating in the same restaurants, sharing in our economic development, and sharing in our overall community activities. And so by doing that, we have partnered with Amani Health Services, Double Up Indiana, IU Health, and Catholic Charities, to be able to have a connecting navigator, which Nin is going to talk to you more about once I'm done. But the navigator is to really be the first resource for that referral. So anybody from the community can refer to the navigator over at Catholic Charities for any Burmese national needing transportation, needing mental health, needing a provider, and that's where IU comes in. So we are really wanting to connect our Burmese population with Dr. Aung's office. She is located on Pettit Avenue, and it's really to have them a home provider that they can go see and not be walking into the emergency rooms or the stat clinics. And then not only a provider that is there for long-term and also speaks their language and knows their culture. She was a former refugee herself. And so if you can only imagine going to someone where they understand what you're saying to them when it comes to something as sensitive as our health. And not only that, but having walked in a lot of the same shoes and in the same paths that those that she is treating have and are coming to her, it's really impactful and it's really powerful. So that's how IU plays into this. We were really wanting to connect our Burmese communities with having a home care provider. to be able to understand them and guide them through their health issues. And then we also have Amani. Amani really serves for mental health counseling. So when the community or the Burmese community, and I have heard this for many of I used to, serve my Burmese community at Healthier Moms and Babies at Victim Assistance, and I worked with many of my coworkers. They don't go to mental health counseling. They will tell you that they are fine. And really, it's very much like in the Latino culture. We'll tell you, and you are nodding, for my African-American sisters and brothers, I think that we are just meant to handle it. We are not meant to show weakness, and it'll get done, or you talk to your family or friends. But it doesn't mean that it is not needed, and it doesn't mean that we don't ask. At the very least, we need to ask, and we need to support by referring. So then they can ultimately make that decision of, no, I don't want to go, or no, I have it covered. But at least asking and guiding them and referring them is where we first start. And that's through Amani Services. They have therapists that are bilingual and can help them with their mental health there. We also have the Double Up Indiana. Has anybody heard of, I'm sure all of us in this room have, but the SNAP? Yeah, okay. So Double Up doubles that SNAP for their veggies and fruits. And so we had a lot of the markets this summer. Now they're closed, but some of our Burmese community now have their own markets to share in their own fruits and vegetables that they grow, and they're able to go to this market and double, so up to $20. So it's really getting 50% off, but any of the markets that accept SNAP will double their veggies and fruits. So that is another partner of this collaborative. We have International Houses. Anybody here from International House today? I don't think so. Or no one on Zoom? No? Okay. So International House really helps with transportation. So transportation to Amani for mental health, transportation to the IU provider, Dr. Aung, transportation to perhaps Catholic Charities if they need to meet them for anything, and accompaniment. When we say accompaniment, we mean modeling. So they will go with them to their first doctor's appointment, guide them through that. This is where you go. This is how we get here. Once we get here, this is the paperwork that we fill out. Because that can be a really scary thing. Even when you speak the language and you know the area where you're at. I remember going to my first doctor's appointments and I'm like, oh gosh, I gotta call my mom for some of these. I have no idea, right? Different language, different culture. You just add on that anxiety, right? And so International House is really good about doing that. They will accompany them, they will provide the transportation and go with them enough times that they feel comfortable and ready to go on their own. And so then comes to Catholic Charities. And Nin is here to be able to tell you a little bit more about the services.
She's only 3 months with the program. She knows everything. I had nothing left to share with everybody. If you have a question, here's a lady.
This is a setup.
Yeah, exactly. You can't complete it 3 months. So, oh my God. First of all, I really like to thank the St. Joseph Head Community Health Foundation initiated this program to additional benefit to the Burmese population living in Fort Wayne. So before that program, Burmese population are already been solved with this organization, many refugee service providers in the community. But after that, we received it funding collaboration with the ACHEC program, they can benefit more, including transportation, interpretation, translation service as well. So before I'm going to be started with the service coming through from this program, let me share with you a little bit about the Burmese population in Fort Wayne. So I just very fortunate to see Angel here today. So I'm gonna say, so most people think that the first Burmese population arrived in Fort Wayne because of the Catholic Charities refugee resettlement. Angel's father, I just asked him, he arrived in 1955. Can you believe it? I met Angel and her sister officer. I asked about her father. Her father, I'm gonna be describe his position. He very fit, physically strong, long ponytail, leather jacket, jeans, and then kind of the common shoe he wears. I asked him, how's he? His angel said, he stayed safe. He's now 91 years old. My father back home, 94 years old. My mom passed away last 2 years ago when she was 93 years old. So of course, Burmese refugees started resettling in this area in 1991. Can you believe it? 33 years already. 33 years. When I arrived in this far away as a Burmese refugee, resettled by this Catholic Charities, I working with 24 years already, only 34 Burmese people. Can you believe that now Burmese population in far away, this host Burmese community reported a little bit over 20,000 already. Burmese people living it. Most of them came here as a refugee startup, but lately we started seeing the different startup, asylum seeker or something like that, Burmese immigrant population as well. People always asking, why is all Burmese people come to far away? They don't go to the different place. They always asking me, of course, because of the situation back home, military regime is still continuing more than, I would say that 60, 70 years already. Burmese outbreaking, Burmese refugee escaping from Burma is still continuing. Many millions of Burmese are out of the country. Of course, Burmese resettlement is not only in Fort Wayne, they are everywhere. New York, Buffalo, Minnesota, Texas, Washington, D.C. Some even refugees go to the Hawaii. I had 2 stepmamas, they resettled in Hawaii, but they come to Fort Wayne. I said, why you just live in Hawaii? That's a place to live. So they said, no, they left Fort Wayne, so they came. So that, all that 20, a little bit over 20,000 Catholic Charities resettled all these years, started from 91, a little bit over 5,000. They came directly to Fort Wayne, resettled by us. You resettled 5,000, now 20,000. What is it? Yeah, of course, second generation already that within this 34 years. Another thing is that we call the secondary migrant population. Burmese population, like I said, going to the Texas, going to the Minnesota, different state, different city. Many of them, they are moving into Fort Wayne. And we call it as a secondary. Why they moving into the Fort Wayne? Yes, we see that, of course, these wonderful organization in the live Midwest, vision, everything that we're coming forward, they feel like Fort Wayne is a welcoming city. Another economically, very much, they are not very much challenging to find employment. All the living costs and then their income is very good for them. Another thing, they can commute each other very easily. Living in a refugee arrive with no speaking English, living in New York, they have to take subway, bus, they scare around the people that don't speak and Dutch language. So for which they communicate each other quickly, the whole city. So that is a reason, I think, also they think that Fort Wayne is Wakanda City. So now Burmese population for Wayne is over 20,000 already. Lots of good things, lots of things to stay working on it, lots of challenging that honestly, lots of kids, they doing good in the school, great, they turn out really good. Some children stay challenging. For all of them, that is the starting point. IU Healthcare Collaboration, Dr. Choma Aung. She was resettled by Catholic Charities when she was made a school. Then she just a high school internship the whole year with our program. She told me that one day I want to be a doctor, I want to be sought for the refugee population. Then now she became the doctor. So that is the starting point. IU had investing on her, opening the healthcare clinic at the Pettit Avenue. And then also we work collaboratively with this wonderful organization, Amani International House, St. Joseph Health Foundation, or called Catholic Charities. I'm pretty sure everybody know Catholic Charities. I'm making sure I brought the flyer so that you know. If you don't know before, you know today. So we saw Catholic Charities is just one only resettlement in the resettlement agency in the northeast Indiana. We resettled approximately about starting from the last 10 years. We resettled somewhere around 200 to 250 refugees every year. Majority of them are Burmese. But when we say Burmese, that's people from Burma. But sometimes we see the experience that people of Burma, they have a different ethnic tribe. Karen, Chin, Mon, Shan, Burmese, they speak differently. They brought different culture as well. That is a little bit of the challenging. Even within the refugee resettlement and Catholic Charities, we all speak together 19 different languages. But sometimes it's still challenging for the Rohingya people speaking language or something. We still have the challenge. I am very much understanding when you're serving the Burmese population, we have pretty much challenges about their culture, their language, barrier, or everything. We usually do before the health clinic, we do the initial screening, follow a doctor appointment. But like I said, that we resettled over 5,000. That is a government program coming. One, the population needs service is way more than this 5,000. With that being said, this program is benefiting much to the Burmese population. Like Jackie said, I didn't know that Hispanic people don't believe in the mental health too.
Yeah. We're getting
No, they believe. Burmese people mental health are caught. They don't want to expose that they have mental health treatment. No, that is not a good thing. Other people know they're hiding. No, I go. If they had the issue in back home Burma, people are consult with their close friends. They invited. Even though husband and bedroom husband issue, they invite close friends to make overcome with that situation. Their close friends are becoming judged. You know, you should do it that, you shouldn't do it that, you should do it that. Okay, that's it. We don't want to hear anymore. So also sometimes they invite neighborhood, next door neighbor. They invited to overcome with the challenging situation issue. This is culturally. Also, the country is a very poor country, so other services are more important than the mental health service. That is another issue as well. With that, this grant is now we are able to reach out people need a service to the mental health. We try to use a different language to mental health. So you have the mental health issue, they're gonna be upset with you. So we have to find a different wording and a talking point. So different way of setting the treatment. Now, Amani is a very good experience working with the Burmese client. So we are very much benefiting. We are referring to the Amani Health for the mental health service. Also, we are now working on a culture orientation, self-sufficiency training from the Catholic Charities. We also helping them apply WIC appointment, the SNAP program, at the FSSA program, case management service. We doing everything through this grant, additional to what we already been have. So Catholic Charities, just like in the flyer said, we have, when the refugee arrived, they brought very limited belonging. Since that day before they arrived, we had to be started housing set up, everything they started pouring. Now we had to be making sure government want us to making sure, hey, your client, I want to see them engage in employment within 4 to 6 months from their arrival date. Because the program, government program, if the refugee, they don't want refugees to be always dependent in the public system. Then after they engage in employment, they become economically self-sufficiency. It dependent from the public system. That we had to report. We had a very good, successful employment rate, regardless of their English scale. We have good employer relationship. We've been now in 6 months employment outcome is about 86% we have right now. Very good. But my 24 year with that, it is good, but disadvantage on other side. You know what happened? Parents, employer, adult, they started making money to support their family. They left behind the integration process. They left behind the English learning process. They slowed it down. They started involved making money. They started wanting to buy a car for their children. They started wanting to buy for the house. Then they left behind learning English, learning culture, immigration, and left behind. Then children became Americanized. Then they had issue later in the long term. That is our experience. But that, of course, this additional support, additional funding, additional collaboration, make that ease in this, not everything. We have opportunity to continue the ESF program. Recently, we had collaboration with the PSW. Now refugees are able to go into the land at the PSW with PSW Catholic Charities collaboration. So they are providing the no-cost English teacher facility. Now I plan to working with her to a Hispanic population we saw as well too. So we are able to continue it. Now this program, ACHEC Collaborative, especially is now very relatively new. We started in the last March, functioning everything, and then now we are in the pilot. Now we gain more knowledge about how we're gonna be make more benefit to this program. Now we are now in this room. We started with the collaboration there. We're gonna be exporting this collaboration to solve more for that, the population and living it forward. Of course, sometimes we got feedback and community respond to the Burmese population, the way they're living in the community. I totally agree with that. I am totally understand their frustration. Many of the refugees especially from Thailand, they live in a refugee camp for 20+ years. It is very much challenging. Every cultural orientation I participate, I ask and introduce, how long you been? People born in refugee, oh, I'm 23 years. It's very challenging as soon as they arrive. So we continue doing that. We have done lots of them very successfully, but we still have to do a lot. Now I met with the new mayor, and then she expecting us, especially everybody, to move community engagement. We are in the process, working with the law enforcement, working with the mayor, working with this all organization, community engagement for the new arrival people and our residents. So hopefully it will gonna be turn out good, positive outcome, and then we will keep more. But to be honest, we can't do it alone. That one, the resettlement agency, government send it out to the timeline or the funding, they send it 3 months, 6 months, and then new people are just like a train station. We are at that four-way. That's train, all the newly arrived person, we do everything. Then we have to start prepare for another thing. And so we need collaboration. Please contact Catholic Charities, regardless of, I'm not saying that only the refugee health issue, regardless of whatever issues you want to know about the population, you need assistance, please contact Catholic Charities and me. I will try as much as possible with not in my resources. I've been with program for 24 years. I work with Meg Gisela for the 24 years since the beginning. Sharon, I know for a long time. This is an organization last the annual gala organization, the first COVID vaccination shot started that your organization, the one. So I work with Shannon for as much as possible, transportation, interpretation. I really appreciate that everybody is working for everybody in the community. So we Catholic Charities want to be part of that, your effort as well, all the time. We will do it sometime or call. I totally understand. Hey, Catholic Charities not doing enough for the refugees they brought over here. I take it. I'm never going to be refugee. No, that's not mine. I'm not going to be say that. whatever you think that because that is important about it. Now, Burmese population alone is close to 10% of the four-way population. Their good is community good. Regardless of whatever they came from, since they became a community member, we want to see each of the individual are law-abiding citizen, positive to the community. That is a community is growing up together. We cannot let nobody behind, regardless of Latino, regardless of Burmese, whatever. We have to be making sure that everybody is as much as possible becoming turning out in the positive community manner of it. So we are willing to work all the time together. Whatever you think you need it, let's sometime, hey, come and talk about Burmese culture. Please send me the email. I will come and talk, explain about East Caribbean culture, Ching culture, Hmong culture, Burmese culture, everything. I will do that as much as possible. I'm gonna be positive. I shouldn't, did I go too long?
No.
Okay. I'm gonna pause it. If you do have a question, I'm very happy to respond.
Thank
Okay?
you so much. That was very informative. I think also a little background information just on how much work Catholic Charities have done dating back to the 80s and the numbers that are here in Fort Wayne. I hadn't thought about it being 10% of the Fort Wayne population.
Almost, yeah.
So any questions in the room about the program or anything that came to mind while they were speaking?
I did want to share that eventually I'm going to be sending out the new trifold out. We only just put it up there as talking points because as you learn and as we're learning what works and what hasn't, we've had to pivot, as many of you in programming and services know. That always comes with that, but for the betterment. So initially, we were going to have the navigator be at the Allen County Connect office, but there was not enough traffic coming in. And we really needed to be out in the community doing outreach to really be able to be seen and heard of so that our Burmese nationals could really benefit from this collaborative that is very intentionally meant for them. And so we are working on updating and
We'll send it out, yeah.
we'll send it out to everybody. And so that everybody can feel free, if you guys encounter within your own services, something that is beyond your capacity for Burmese nationals, you can always reach out to Nin and his team.
So my question is, so where is, this is Sharon, everybody. What is the connecting point? You have this collaborative and you have all these wonderful organizations that are coming together and working together. So where are people, where do people in the Burmese community, where do they go if they want to take advantage of all of it?
I guess I could go to all of them, but really I will let you.
The first time we thought that if we put that the first connecting point, we put in the Allen County connect at the
like a navigator.
right,
So that didn't work, so.
Yeah, so if that, because of we moved back to the Catholic Charities. So we have already been resettling initial arrival. So last 300 people, we resettled about 200 or a little bit more Burmese already. So we gonna be in the cultural orientation. We explain about the additional benefit. Also, we are also reaching out the community outreach to be sharing the information to the Burmese community so that they can reach out the Burmese speaking navigator at the Catholic Charity. So he is starting point and hey, this service is definitely going to the Amani. This service is definitely going to the international hub. This service is going to the develop. So that is, we are started making that networking right now. Is we will be also reaching out, updating this flyer, this navigator will reach out the Burmese church, Burmese Muslim population, Burmese Chin population. He will be visit to the Sunday gathering, passing this information. So that can benefit. Even though Burmese population, because of not the culture, because of the system, most of the Burmese population, they don't think that preventative health is not important. They're going to see the doctor, they say, I'm gonna try 144, no, I can't go to work, I take me to the doctor.
That's
So
me.
when I was case manager, I took the Burmese population, they look around and why these people in the doctor office, they look lipstick, makeup, and they look everybody healthy. Why they are in the, they ask me, why the people are here? They don't sick. They don't look sick. They are everybody fine. So they don't think that preventative health is very important. So that in the cultural organization, we put a lot. No, when you get sick, your time, Catholic Charities, start time, transportation, gas cost, how many evaluation, how much it cost. Before you prevent it, you don't get sick.
Okay.
So say that we are, the education process is involved in the, also we are encourage them to assign PCP, personal care physician. Most of the people, they don't believe that they had to have family care physician. So this education process allows to make in the improvement, actually get the treatment. We want them to be a little bit proactive about the healthcare system. So that is the COVID one time we are driving around, passing a precaution thing, everything. Then if you got a COVID, you start with lots of money involved. So we try is being the proactive, working with all the organization. Hopefully, I had the good feeling. So that will be benefit a lot to the population and the community as a whole. That is.
Were there some questions online?
No,
Yeah, oh, sorry.
Go ahead.
Well, this is Diana. I was just asking, it seems that, I know there used to be a Burmese advocacy center before, and I don't know if that is still active, but there is the Muslim and Burmese education center that is very active. To me, it would make sense that, well, maybe not, but it would seem that it would be nice to have them included as well as part of the partnership, because, I mean, it is an organization that is led by the Burmese people themselves. They're offering different types of services. I do think it's a good idea. But my other question is, and this is for you, Nan, when, because you've been so involved with the resettlement, and I remember the first wave that I worked with was probably early 2004 in my international days. But so is the goal really to also, once the people are arriving in Fort Wayne and being and they've completed the resettlement process, is the follow-up, is this service sort of to continue the follow-up so that the families or the people will have additional service provided to them outside of what Catholic Charities can provide?
Of course, that's exactly, dude. Just like the resettlement agency, I just said that government setting up the case management timeline. Then they send new people to start reoccurring with the new people. Yeah, we do have the follow-up appointment, but it's left in the case management healthcare system. So we also have the newly arrived, but we still continue. We do have the extended case management program, funding raising by our own agency. But to be honest, we couldn't reach out the whole community with our own funding. But that, of course, that is the IU Health Collaborative is a very great addition and benefit to the people beyond the resettlement timeline and the case management. I believe that this is a head vision. Everybody is continuing serving that, but sometimes I see that I really believe and appreciate that that's kind of meeting. Then that can benefit. Each other and extending our resources to the population in that is Dr. Diana, that's true. That is the one big benefit of the beyond the resettlement timeline for the extended our healthcare service for the population. Yes.
And then I just have one more follow-up. I apologize.
Yes.
So I know that with the generational gaps, because many people have been here for so long, and so you have the younger generation that they kind of know what services are. Are you working with a specific population and looking at the older generation that perhaps are still not getting out, or is this everyone?
This is everyone. This is all Burmese nationality. All Burmese nationality. And then not just a younger or regardless of their age range, we can be working with through this domain. Also, I'm going to be sharing with you everybody. Now, Burmese population, they have their own home care service. Actually, 10 home care service owned by Burmese population. Many of the people over 60 and disability Burmese people and other population are also benefited from these Burmese own home care service as well too. Yeah. So but especially from me, there's understanding the education process make that population change. Service is now benefit, but their understanding about the healthcare system make that situation change. So every time that is the area Catholic Charities also put more effort. So we do have a 3-day, 8-hour cultural orientation, continuous cultural orientation. But I'm not saying that everybody take it. Sometimes it's hard to working on it. Also the integration process, also that is a two side working with the integration process. So that is the reason I just now started the collaboration point with the law enforcement and the mayor office engaging the local community and newly arrived immigration about learning and making friends each other. So that is the only way I believe that integration success.
And to add to that generational gap or emphasis, if the older generation was never exposed to this education or preventative health support resources, they would have never passed it down to the younger generation, and it will just be continued as a cycle. So I think by reaching out all those in need in the Burmese community in general, we're going to start closing that gap and really reaching more, so that is a new norm for the new generation to be able to know what is available for them, and that they are indeed worthy of having, you know, good health, and then passing that on to their children is the hope anyways.
Yeah, so my question is, I should have sent that message because as soon as I start talking, it calls me. So my question is, and as we talk about health, we talk about food, we talk about mental health, transportation, all the things that help a person become functional in our society. Do you guys partner with any financial institutions to help with the financial health of a person? Because if you can't afford food that is healthy, then that's a problem. If you can't afford, if you don't have health care, if you can't afford health insurance, then there becomes a problem. So as we talk about transitioning people off of government assistance, one of the organizations I work with, we deal with a lot of the cliff effect, because once you get to the point where, all right, I got everything sustainable, and now I have to do this on my own, and I don't have that support, how do you like live if you just stay right there at the cliff? It's like, I'm never jumping off this cliff into financial success or just being sustainable. So I'm just curious if you have any partnerships or any organizations that you work with, and if you don't, I know a guy.
I'm gonna be looking at you, man.
Okay, that one, that I will maybe my response will be a little bit of the starting point. Every refugee, they came here at the United States, they are documented, they are granted permanent resident before they arrive into the United States by the Homeland Security, USCIS, and Department of Homeland Security, everything. They had the vetting. The day they arrive, they are permanent. Their eligibility to, we are the agency. The next day, we had them apply for the public system, including Medicaid, SNAP program, monetary system. They continue. Before this, family with the children, they are settling longer. Before that assistance is losing away, we are the agency to making sure they are engaging employment through the health insurance through the employer. Okay, that point. Also, people is now able to, we had the program helping them. Indiana had the plan, Obama healthcare or whatever healthcare system we're working with. We are the one financial resources when before they are engaging employment. We support house, rent, pocket care, transportation system, almost everything until they became the financially secure the family. So that is the thing. We are now in collaboration with the Flash Star Bank and them, so coming to teach financial literacy, family budget tracking system. So these are them. At the end of the 8 months, we do have the integration, the self-sufficiency and integration coordinator and his team visit to the people. We result at how we are measuring, started with the self-sufficiency matrix, integration matrix. We started planning. So at the 8 months, but if many of the refugees at the 8 months, I said that at least 86% became financially self-sufficiency. After this matrix measurement, we know which area we had to be working in more. 2 areas stay low point. If healthcare and education. Healthcare is still, they are saying, but they have the insurance, but they do not know yet for the what is the healthcare system work in this community and this country. Education, all the children, we are responsibility to enroll in the school within 30 days of their arrival. They became, sooner or later, they speak like American children too. But parents, they're very, because of some parents, they don't even know illiterate in their own language. Their movement is very slow for the education thing. Yep. So these are the financial institutions we working with. It's just like a Flash Start is coming to train them. Also, we are helping. What about the assistant? Most of the people we work with. Like I said, that we set up in the Catholic Charities, we do have government funding to support them. So we experience that most of the people, they are very much successful. They're willing to make money soon after they arrive. And they gain that. So yes, but whatever a resource that you have, if I'm willing to take it. Doesn't matter how good we bet, we do, never gonna be extra. So I'm definitely gonna be connect with you. Please, you can come and visit our office. I invite you, meet with the, what about your connection? I'm happy to connect with every.
I will give you a heads up that we have a hefty fee of $0.
You're the man. So I'm gonna be so started. Okay. Thank you so much for the question. Thanks for the opportunity for the explaining. If you do have a question, I'm happy to. Yeah.
I have a question. So if somebody already has a case manager through another agency, and they just kind of need 1 or 2 pieces of this, should they still start at Catholic Charities, or should they go directly to, if they just need the doctor services or the?
They can start with the Catholic Charity. If they already been connection with this organization, they can go. But if they do not have the connection yet, send it to Catholic Charity. Catholic Charity making the screening process, and we were going to be sent it to the appropriate organization service. Yes.
Okay.
Carla, I know for Carla how many years? She is a team lead for that. When I work in a 4-way leadership program, 4 people coming to the where you used to be Vincent Valley. Yeah, so long time. Good to see you again.
Any other questions in the room?
There was just one more online.
Okay.
Are there plans to include other refugee communities?
At that point, this grant is for the Burmese nationality at the starting point. In the future, I would say that we can expand to the other refugee population as well too. But this IU program is just for the Burmese nationality at that time around. Yes.
Right, but they can still contact Catholic
Yeah,
Charities for
we
other
do have
refugee
other
assistance.
refugees. So other refugees. We do resettle, we resettle refugees from more than 20 different countries. So please send it to our way. So
Well, thank you so much for all the information. I'm very excited to see this make progress in our community. I know a lot of the little side conversations I've had, somehow they end up leading back to the youth in the community. And I do think it goes back to that generational starting point and the education. And I feel like, you know, if anybody knows what it is like living in a refugee camp, it is basic survival. You're literally just trying to find food and stay alive. They are not concerned about any preventatives or anything beyond tomorrow. So it is definitely a mind shift and a culture shock coming over and saying, okay, here's your timeline, you've got to do all these things when they're literally in complete survivor mode. So I'm really excited to hear that there's this educational piece to help along that adjustment and to have so many awesome organizations collaborating on this and for us to be in the room together to hear about this. I think that, you know, one of the conversations I've had a lot lately is it's just like raising children. We say it takes a village to raise children. It takes a village to heal the community. There's so many needs in this community. There's not one organization that can do it alone. We all have to come together.
Even in a refugee camp, there is gangs, there is crime, and even over there, children and women are raped. It's pretty bad.
It's not safe. There's not medical care. There's food is very scarce. It's not a good living condition, but it's somewhere to be until you get to where you're trying to go. Well, I welcome you all to engage in some networking, have some snacks, exchange business cards. Thank everybody on Zoom for joining us. Hopefully you'll join us in person for the next one. We have, I lied, don't move. We have partnership sharing and Health Vision sharing. So on the table, you will see we've got a couple handouts. Health Visions is hosting a Healthy Heart, Healthy Families and a coat drive. Mia and our heart coordinator will be having the Healthy Families, Healthy Heart at the Pontiac branch on November 7th. We are hoping to receive enough coats to hand those out at the coat drive and at the hair care day, right?
Yes,
Okay.
but our main focus right now is the coat drive. So we are accepting new coats. You can come to the office or you can reach out to me. I'm willing to come pick them up. And we are accepting them through November 6th because our main goal is to be able to hand out as many as we can at our event on November 7th. So yeah, so it'll be a great event. Please come out. We will have some community partners there, great family resources. We'll be doing some fun activities for the children and families and healthy activities. So it was great. Please come out. So your clients can come out if they can.
Any certain sizes?
Yes, so we are looking for toddler through teenage.
Okay.
Yeah, so starting at like 2P.
Okay.
On through like 16, 18. If we can.
Okay.
Yes.
And so I just want to thank you guys all for having us out here, for hosting us. Health Visions Midwest is, you know, entering into a new era under the great direction of Sharon as our ED and Angel as the director here. And recently we received funding to do a collaborative project between Lake County and Allen County tackling diabetes amongst underserved populations. And so that's why we're also here today to work together. And both of the project in both areas includes a lot of input from the coalition. And so we want it to be a project not just ran by us, but really supported and counseled by our coalitions and everybody get involved in that. And so as we continue on with this journey, and we look forward to working more with you guys, and hopefully you guys are going to be looking forward to working with us. and it's going to be a really good project. It's a 4-year project, and we're really excited for it.
Yeah, and we too are at the rollout stage right now. So they are actually here this week training with us. And it's going to be I think it's going to be very helpful in the form of providing that education, but also connecting and working with other health organizations for screening and prevention. And we'll be able to give some healthy tools away, glucometers, lots of dietary and nutrition. So I think that it'll be a great partnership with a lot of our community organizations. Peggy, do you want to talk about Garden Thursdays real quick? A little bit?
I'm so stressed.
No.
That's the thing tomorrow. That's the thing tomorrow, so.
We're all gonna be there.
So we have a thriving Thursdays tomorrow, and the room again will be packed like this. And we'll be talking about the stress issues and how it affects, mental health and stress issues. So we'll be talking about that tomorrow, starting at 10 o'clock. Right here.
Right here?
Thank you.
Right here.
Right here. Lupita, do you have any updates you'd like to share about your programming?
Well, I have a health club that I'm running with Latino women. So I have them here on Friday, and everybody brings something healthy, like one brings carrots, another one brings spinach, and we make a buffet of healthy food. And we do exercise. Sometimes I take them like to take a walk to a park, or a couple of weeks ago we were at the zoo, or we do some exercise here at the office with music we play, and they love to do that. So if you have like Hispanic clients, and they will, you'll be thinking that they would like to be here, so then they'll be so isolated. This could be a good idea. In a couple of weeks on November 1st, I'm gonna have a conference of domestic violence. It's a collaboration I'm making with the prosecutor office and with Amani. So it's gonna be bilingual, English and Spanish. So then in case you would like to come, or you have someone that you think would benefit, we're gonna be talking about protective orders and domestic violence in general. Thank you.
Thank you. Gotcha, Community partners, any community partners have events coming up? Anything you want to share?
I mean, it online.
Okay, Colleen.
Hi, everybody. I just wanted to share one success and then some upcoming trainings. Last weekend, we had 14 Black youth come together to sort of kick off a youth ambassador program where they're sort of leading the way, trying to better understand why Black youth are have the fastest growing suicide rate. And it was very successful. People were together Thursday night, all of Friday, all of Saturday, and even Monday. It was fall break for a lot of schools. Working with a researcher whose focus is on Black youth mental health. And the youth are really excited about this project and leading it. And they've named themselves BLISS, Black Lives Inspiring Suicide Solutions, which is really cool. And they have sort of a research agenda to better understand, like engage their peers and better understand what's happening for them around mental health and suicide and what we can do about it. So that is huge. We've been planning to do that for 2 years, and we're finally kicking that off. So we're super excited about that. And then just to let people know, I'll put it in the chat too for other folks, but we have a training on Friday at 8 to 9:30. It's virtual, and you learn how to use the Columbia Suicide Severity Rating Scale, which is a mouthful. We call it CSSRS, which is still a mouthful, but if people want to learn how to use that, I'll put information in the chat, or people can email me. And then on November 15th, we have a training in Columbia City at their library for free. It's QPR, question, persuade, refer, coupled with training on the CSSRS. And you can do one or the other. You don't have to stay for both trainings if you don't want to. And I'll put that information out there too. So thank you very much.
Awesome. Thank you, Colleen. Any other announcements or upcoming events on Zoom? No? Announcements or upcoming events in the room?
Yeah, we are having a diversity dialogue November 14th at noon at the library, and we're featuring the library this time and all the ways they connect with diverse communities and promote positive things and have partnerships. So it'll be an interesting learning experience. And A lot of people have been wondering where YWCA is with our move and everything. We are fully operational at 1313 West Washington Center Road, and now our meeting rooms are open as recently. So if you have people who've experienced domestic violence or sexual violence, the advocacy services, the therapy services, the residential services are all open, functioning, even with space to meet. So, so that's good.
Lots of space.
What time on the 14th?
The diversity dialogues at noon at the downtown library, rooms A and B.
Thank you, Carolyn. Any other announcements, events? Now I welcome you to social. Thanks for coming today. That's a great meeting.